Vamos a hacer un video sobre algunas, algunas preguntas que necesito hacer. Y let's go. No sé por qué dice que no se puede minimizar. Sí, ya yo lo he hecho anteriormente. Es, mm, bueno, vamos a ver estas 50 preguntas. Espero que esté grabando. Dice, eh, ¿por qué debería ser abolido o no hecho eh, metronidazol tomándose telquinflagyl? Alcohol consumption while on flagyl metronidazole can lead to a disulfiram-like reaction. Flagyl interferes with aldehyde dehydrogenase, resulting in the accumulation of acetylsdehyde, which causes symptoms similar to those experienced with disulfiram, such as flushing, nausea, vomiting, and headache. Yo creo que este es el efecto antiabuso. Lo importante aquí es la dehidrogenase y la accumulation of acetaldehyde. ¿Cuál es el principal mecanismo que ejerce la metformina en el metabolismo de la glucosa? Yo creo que incrementa o disminuye la producción hepática de glucosa. Ok. It decreases hepatic glucose production, decreasing intestinal absorption of glucose, and improves insulin sensitivity by increasing peripheral glucose uptake and utilization. Esto es importante porque además que la metformina decrease gluconeogenesis, eh, también aumenta los receptores de insulina. Describe el mecanismo que hace y tratamiento de la aspirina exacerbando respiratory disease. Aspirin exacerbate respiratory disease es un, es un problema común en el asma cuando la persona toma aspirina, y es porque la aspirina es un inhibidor de la COX-1 y los inflamatorios no esteroideos can shunt inflammatory precursors down the leukotriene production pathway, increasing leukotriene levels and causing bronchoconstriction and inflammation. This can alleviate by leukotriene inhibitor like Montelukast. Entonces vemos que la aspirina tiene, tiene un efecto en los inhibidores de la COX y pueden aumentar los leukotrienes causando vasoconstricción y llevando a asma. ¿Cuáles son los síntomas relacionados a la hipercalcemia? La hipercalcemia está caracterizada por algunos síntomas como serían las piedras renales o las piedras en la vesícula biliar, eh, en los huesos, incluyendo bone pain, to osteoartritis fibrosa cística, abdominal pain, nausea, vomiting, trance, biliuria, constipation, and psychiatric overtones, like ranging from depression to coma. What sonic infection should be considered when patient present with silent necrotic Epinuclear nodes after camping. Plaga. Causing by Yersinia pestis can lead to bubonic plague characterized by swelling infected nodes, bulbous, treatment typically involves aminoglycosin targeting the 30 ribosomal subunits. What is the purpose of ROGAM and what is it administered to a risk area negative mother? The purpose of ROGAM is to bind to remove the area D antigen so that the mother doesn't form an immune response against the antigen in the fetus blood. It is given to a risk area negative mothers at 28 weeks and delivery. Does the hepatitis C infection lead to chronic viral injury in the liver? Yes. The infection results in chronic viral injury in the liver. The viral peptides bind to class 1 major histocompatibility complex molecules which are endogenous or intracellular and are the targets by CD8 cytotoxic T cells for destruction. This immune response contributes to ongoing liver damage. Class 2 MHC molecules are found in professional antigen-presenting cells, while CD4 T cells are helper T cells and do not directly cause cell injury. What is the likely cause of pneumonia in elderly patients who has difficult swallowing? Aspiration pneumonia, commonly affecting the right lower lobe, is the likely cause of in an elderly patient with difficult swallowing. What does blood adenomatous typically indicate and should it be evaluated? Blood adenomatous is a red flag for the urethral injury which should be evaluated with a retrograde urethrogram. The membranous urethra is the most common injury by fracture, whereas the puncture urethra is most likely to be injured during trauma, catheter insertion, or a stroke injury. What happens if you clamp the efferent artery in the kidney? Clamping the efferent artery increases hydrostatic pressure in the glomerulus and increases filtration fraction. What cells is indicated by the arrow pointing to a cell with a multi-lobed nucleus and what is primarily role in the immune system? The cell indicated by the arrow is neutrophil's multi-lobed nucleus, which is the main fighter in the immune system in acute inflammation and bacterial infections such as aspiration pneumonia. C5a is chemotaxis factor for polymorphonuclear leukocytes. What is another name for Oscar's disease? And what is etiology? Oscar's disease, also known as apophysitis of the tibial tubercle, is caused by chronic stress or irritation on the insertion of the patellar tendon on the tibial tubercle. It is commonly seen in teenagers engaged in repetitive vigorous activities like running or jumping. Where can endemic Burkitt's lymphomas occur? And what is the characteristic histological finding associated with it? Endemic Burkitt's lymphoma can occur in regions like Brazil and Africa and characterized histologically, finding associated with the presence of tangible body macrophages. These macrophages contain numerous phagocyte apoptotic cells in various states of degradation. What is the mechanism underlying hypogonadotrophic hypogonadism in individuals with anorexia? Anorexia leads to hypogonadotrophic hypogonadism because the body recognizes the inability to nourish a fetus and suppress reproductive function. This condition is often observed in individuals such as gymnasts and or dancers. What is common treatment for diabetes insipidus result from a call? Base version and how does it work? Diabetes insipidus is a potential complication of some skull base fractures. Can be treated with day-day ABP, the most perceived work by activating aquaporin channels. It increased adenosine activity via stimulatory G protein, leading to an increase in intracellular count. This results in the movement of aquaporin channels from intracellular vesicles to the apical membrane surface, facilitating water absorption. What condition present as a congenital intolerance to breast milk? due to inability to convert galactose to glucose. Galactosemia is characterized by the accumulation of galactose 1 phosphate in the body, resulting in various clinical manifestations. Lactose disaccharide in milk is composed of glucose and galactose. What does a odds ratio greater than 175? And what does it mean if the 95 confidence interval does include 1? Odds ratio greater than 1 signifies increased odds, rate, and likelihood of occurring. 95% confidence interval, not including 1. If the 95% confidence interval does include 1, the difference is statistically significant, though not necessarily clinically meaningful. What is the primary cause of acne in girls, and what hormones are primarily responsible for it? Acne in girls is primarily caused by adrenaline, which involve the production of uh, DHEA androgens by the adrenal gland in the sonor reticularis. These androgens stimulate sebaceous glands and contribute to acne development. What type of clinical trials is characterized by participants knowing they are receiving a drug with no randomization in only a single treatment group? This is an open-label trial. Participants are aware they are receiving the drug, and there is no randomization involved, as there is only a single treatment group. In addition to penicillin, what aminoglycoside is included in the treatment paradigm for Streptococcus vibrio endocarditis, and what is the mechanism of action? The aminoglycoside includes is gentamicin, which binds to the threaded subunit of bacterial ribosome and accelerates bacterial clearing and decreases treatment duration. In chronic inflammation, pneumonitis, which cells are increased due to lobarithmal destruction. Type 2 pneumocytes and fibroblasts are increased, can replicate to replace type 1 pneumocytes and fibroblasts increased due to chronic interstitial inflammation leading to fibrosis. I need to make something. Sí. Sorry, but I needed to do that. I was almost forgetting. Okay, what drugs is known for causing sedation, dissociative anesthesia, aggravation, pain insensitivity, vertigo, to PCP. PCP is known for causing disorphagia, is named supramental rag. Describe the phase of fasting physiologic and their dominant metabolic process. Post-absorptive phase, 6 to 24 hours after a meal, dominated by glycogenolysis, where glucogen stored in the liver is broken down to maintain blood glucose levels. Gluconeogenesis 24 hours to 2 days. The body starts producing glucose from non-carbohydrate sources like amino acids and glycerol as glycogen stores are depleted. Ketosis. When fasting extends beyond 2 days, the body begins to break down fatty acids into ketone bodies to be used as a ternary energy source produced by the brain. What is the formula for calculating positive predictive value? Positive predictive value through positive for positive. What hormone is the primarily produced by leading cells? Nuclear manifestation can leading cells stop. Leading cells produce testosterone, and leading serotonin, when physiologically active, can cause masculinization. Intermittent hyperbilirubinemia, jaundice, in an otherwise healthy individual, is typical of Wish syndrome, and what is the underlying? This condition is typical of Giver syndrome, which is caused by decreased activity of ODP glucuronidase. One organism is notoriously known as the brain-eating amoeba, and its common cause of CNS amoebiasis. Naegleria fowleri is the brain-eating amoeba, and its common cause of CNS amoebiasis. It has three forms: cyst, trophocyte, and biflagellate. Infection occurs beyond photoid cells atom to the cribriform plate to the brain. Organism is typically associated with gram-positive growth in a diabetic foot wound or a woodward one soldier fighting in a trench. Clostridium preferens produce gas gangrene. Crepitus in the tissues is due to production of gas as a byproduct of its highly virulent alpha-toxin. Where do many other cavity lesions, especially those located anteriorly, like the hip of the tongue, drain first? Where do oropharyngeal squamous cell carcinoma most commonly drain? Many oral cavity lesions, especially those located anterior like the tip of the tongue, drain first to be mental notes. Oropharyngeal squamous cell carcinoma most commonly drain to the level 2. What is a common bronchodilator used for wheezing and how does it work? How does spin-free comparison the context? A common bronchodilator used for wheezing is albuterol, which works as beta-2 agonist. Epinephrine, which is non-selective and acts on both beta-1 and beta-2 receptor, will also help with wheezing, but in this context, the patient's symptom will be helped most by the beta-2 component provided by albuterol. Where does the alpha value represent by in hypothesis? The alpha value corresponds to the likelihood of type 1 error false positive, reflecting the p-value considered significant. A lower alpha value indicates a lower acceptable likelihood of obtaining the same result by machines, allowing more confident reporting of significant results. What syndrome is characterized by left hemiparesis in right cini-12 palsy in the case of brain stimulation? Cross findings such as right is a lateral tongue deviation in right left side contralateral weakness suggests involvement in the corticospinal tract at the level of the medulla. This syndrome is known as medullary syndrome or the Girino syndrome. What condition is indicated by the presence of air in the fluid in the pleural space and also causal trauma? Either a pneumothorax typically resulting from trauma is characterized by the presence of both air and fluid in the pleural space, and the fluid is blood. The condition is referred to as pneumothorax. Notably, the absence of mediastinal shift suggests there is no undertension. What is BAGF and what are its roles in tissue injury and hypoxia? Vascular endothelial growth factor is a major tissue growth factor indicated by injury, cytokine release, infection, inflammation, and hypoxia. It promotes angiogenesis and increasing vascular permeability, which helps in the movement of protein and white blood cells to the site of injury and contribute to edema. What is mechanism by which acetaminophen overdose leads to jaundice? Acetamino- Acetaminophen overdose causes liver necrosis resulting in fewer fusion liver cells available to conjugate bilirubin. This leads to an increase in the unconjugated bilirubin levels and subsequent jaundices. Glutathione depletion, which occurs during acetaminophen metabolism, allows its toxic metabolite NAPQA to damage the liver. What is the vascular supply of the parathyroid gland? The parathyroid glands are typically supplied by the inferior thyroid arteries, which arise from the thyrocervical trunk. What type of hypersensitivity reaction is content dermatitis? And what is the key interaction involved in T cell activation? Content dermatitis is a type 4 T cell mediated hypersensitivity. The key interaction is T cell activation is the binding of T cell CD28 to CD80, part of the B7 group on the antigen presenting cell. In the heart, what is the closure of the aortic valve? Usually louder than the closure of the pulmonary valve. The left side system, where the aortic valve is located, typically has higher pressure than the right side. Therefore, the closure of the aortic valve is usually louder than the closure of the pulmonary valve. If P2 is louder than A2, it suggests significant elevated pulmonary artery pressure. What is vincristine mechanism of action? How does it contribute to neuropathy? Vincristine inhibits microtubule formation in the mitotic spindle. Is the erosion of the microtubular axonal transport system leads to axonal neuropathy. How are gonna pass? A patient with normal leukocyte count but low platelet counts is a risk for what condition? What are the common clinical signs? The patient is at risk of bleeding due to thrombocytopenia. Common clinical signs include petechia, YMT. Main thrombosis is associated with thrombophilia, condition like hematocrit, neobet, hemorrhage, and visceral hematomas are more common in hemophilia. What characterizes facial fragile cheese syndrome? Fragile cheese syndrome is caused by CGG, children contact repeated expression disorders typically present while with autism-like behavior, a relatively large head, and a large testicle after puberty. It follows as linked inheritance, and the maternal uncle is often affected. What is the mechanism by which H. pylori contributes to the fatty acid formation? H. pylori produces protein acid, particularly uric acid, which cleaves ureate into ammonia, increasing the local pH and amending gastric mucosa. What is the main difference between bolus pemphigo and pemphigoid scattering in terms of histopathology? Bolus pemphigoid is characterized by the loss of hemidemosomes that can keratinocytes to the basement membrane, resulting in bulla, B blister, and area sufficient. Patient with pemphigoid is a perfect skin ulceration, with mouths being more common in pemphigoid. How does manuka regulate fatty acid metabolism? What is the difference in its fat between resting and actin muscle? Malonyl-CoA inhibiting the rate limiting step in the beta oxidation of fatty acids, which resting muscle requires less energy and thus has higher level of malonyl-CoA, leading to reduced fatty acid breakdown. In contrast, active muscle requires more energy, resulting in lower levels of malonyl-CoA and increased fatty acid breakdown. Which class of drugs are typically used as disease-modifying anti-rheumatic drug for ankylosing spondylitis? Used for ankylosing spondylitis are typically the same anti-inflammatory anti-TNF drugs used for other inflammatory conditions like inflammatory bowel disease, rheumatoid arthritis, psoriasis, etc. Adalimumab and etanercept. What happens to endothelial light junction in response to injury and inflammation? Endothelial tight junction permeability is increased, allowing migration of white blood cells and other molecules of the site. With parasite infection is particularly endemic in Africa and is associated with chronic cystitis calcification of the bladder wall. Schistosomas myiasis, commonly found in regions like Egypt, is associated with chronic cystitis and calcification of the bladder wall. Chronic infection increases the risk of squamous cell carcinoma of the bladder. What virus causes bronchiolitis and what is the mechanism by which it is entered the cell? What is the prophylactic treatment? Respiratory syncytial virus is RNA virus that causes bronchiolitis. It enters the cell via fusion protein. The prophylactic treatment is palivizumab, a monoclonal antibody that targets the respiratory syncytial virus fusion protein. How does thiazide diuretic work? And what electrolyte anomaly can do? Thea- Thiazide diuretic work on sodium symphotic in the distal convolution, leading to increased sodium and whatever excretion they can cause hypokalemia. They enhance potassium excretion along with sodium in the body.